Gopal, Dr. Shaini Kurian, Dr. Mangala Rupini, Nancy Amalopagam, then Dr. Rosemary, Swati, Annie, Maria Teresa, Swati S. Rao, Hemalata, Firdos, Gopinath. Welcome you all. Again and again, deep, deep gratitude to all of you for giving me the space for reading our guru, mentor, Dr. Praful Vijayakar sir's books. So, today we are reading chapter 24, that is page number 193. Page number 193. We shall try to finish off this lesson and the next lesson as well. That will be miasm of dreams. That will be very interesting. And in this lesson, with the remedies and their miasms, Dr. Vijayakar sir is giving insights regarding the tri-miasmatic nature of every medicine. So as we said, not only the polycrust remedies, everything, every disease, everything in the world, even every medicine has got its own soric phase, psychotic phase, and syphilitic phase. In the growth, you can see sora, psychosis, and syphilis. In the seasons, you can see everywhere, you can see in intensity variations, you can see sora, psychosis, and syphilis. So here, Vijayakar sir is giving many examples. Just consider this as examples, dears, because this is not an exhaustive list. He has given the sora, the psychosis, and the syphilitic symptoms of many medicine from aconite to zincamet, but then this is not an exhaustive list. This is only an example. So let us go through that. And remember, this book was written some more than 20 years back. And now Vijayakar sir has evolved so much that all our thoughts are also evolved a lot. So consider this as like how to classify the symptoms into sora, psychosis, and syphilis. In certain medicines, only the sora and syphilis will be given. That doesn't mean that it doesn't have any psychosis, but then the psychotic phase will be very, very less. So such remedies will be more like predominantly soric or predominantly syphilitic, etc. Hope you will understand that. Now coming to the first remedy, that is aconite. Aconite is most famous for its Am I audible, dears? Sorry for the improper connection here.
Yes, ma'am. Now audible. Please
Yes.
continue.
So even Dr. Samuel Hahnemann has given in his aphorisms like between 210 to 220, somewhere around 211 or 212, where he talks about the explosion of latent sora. So explosion of latent sora is nothing but it goes to the highest degree of violence, and that is the syphilis, and that is the sorosyphilitic, that is the most exaggerated state, exaggerated form of the syphilis, and it will be like a flame bursting out, which means it will be like fire. It will be like wildfire, where you cannot see any structural damage, but then even the structural damage are there. The delirium or the mania or the insanity will be much more. That is the syphilitic nature of aconite, where it will be mostly sorosyphilitic rather than psychosyphilitic. In aconite, almost psychosyphilitic is not possible. because where there is no psychosis, psychosyphilis cannot exist. But Sora is in the highest in aconite, so sorosyphilis is possible. And aconite has been the first remedy advocated by Hahnemann in that aphorism, where there is the violence or where there is the exacerbation. Any acute exacerbations, especially in deliriums, especially in schizophrenia kind of thing, where everything in the lucid interval, everything will be going on calmly, just like the waves just like the calm waves of the ocean, and suddenly there can be turbulence, and that is the exacerbation. Other remedies are veratrum album, stramonium, belladonna, merxol. Aconite was the first medicine, one of the first medicines advocated by Hahnemann there. So aconite is famous for syphilis destruction, which means it is the sorosyphilitic in nature. Now coming to ourselves, inflammations and anxieties. Of course, you know the anxiety of aconite as well, like it will be mentally and physically restless and all that. In the psoric phase also, it will be prominent, but then in the syphilitic phase, it will be too much exaggerated. In ourself, it will be more of the mental. Ourself is what mentally and physically is it? Yeah, just like the horse. So the inflammation, and he straight away gives the syphilitic symptoms, like where ourself can be thought of. Those are the ulcers, gangrene, anguish. Okay, you know about anguish, you know about anxiety. Anxiety will be that kind of an apprehension which is felt, that is in the psoric phase, and then it will be named as fear in the psychotic phase, and it is named as anguish. That means the intensity wise, it will be more and more. I shall give you a case of gangrene where arsenic album was advocated, and the patient has come from the syphilitic miasm to psychosis and then back to the psoric miasm. So arsalb is a very good remedy in the psychosyphilitic phase as well. Now coming to ars iode. Ars iode is more of psoric. So inflammation and diligent. Of course, all the iodine groups are very, very diligent. And there is more of acridity and excoriation. You all know about that. ASF, arsulflavum, is known for its destruction. That is, it was like kind of for vitiligo and all, it is a specific, where there will be destruction of the melanocytes. That is the reason why the skin becomes white. So that is the destruction of ASF. Coming to argentum nitricum, in the psoric phase, anxiety and restlessness are highlighted. In the psychosis phase, argentum nitricum is a miser and censorious. In the syphilitic, it can be impulsive and there can be ulceration of the cornea. Agaricus, mostly a psychotic remedy, where there is show off, neglected feeling, braggart and boaster. So these are all the psychotic symptoms in the mental plane. Coming to aurum sora, it will be like smiling always, and aurum syphilis, that is destruction. Anxiety conscience of. When anxiety conscience of is the highest, it can even go to the autoimmune level, where there will be self-reproach. Self-reproach will be the highest rubric of anxiety conscience. And ulcerations and paralysis, corroding and suicidal tendency. The melancholy of aurum is most famous or most notorious, I should say, going into suicidal tendency. Real suicide will be committed by aurums. Now coming to acid floor. Acid floor, mostly a psychotic going to syphilitic. That is, it loves luxuries, cars, and it is, yes, keloids. For acid floor, the most psychotic symptom will be the keloid or the thickening of the skin or callosities. And in the syphilitic phase, destruction. Of course, it can be given for varicose ulcers, venous ulcers, non-healing ulcers, etc., where there will be jagged edges and all that. Alumina, mildness and irritability. Now, how will you identify an alumina in your daily practice? Alumina is characterized by its mildness. And here the patient will be rather naive, and mostly it will be like the example will be that of a lady. So she will be having constipation and sluggishness and slowness and so much of mildness, and she will be having a mild smile also on the face. That will be the typical alumina smile. If I get a picture of that, I shall share with you. So in the groups. So alumina for any complaints from top to bottom, mostly it can be leukorrhea or it can be any female complaints or constipation or for any complaints where there is a lot of dryness or itching and all that. Now the patient will be characterized by the mildness. When the patient is mild and smiling, you can always think about alumina. Alumina, I think, is a less prescribed remedy. In our clinic, we regularly prescribe alumina, and the acute of that will be bryonia. And in alumina, there is anxiety, conscience of, and paralysis. All these ladies, no, like who have exerted themselves and given their lives to the family, eventually they come to that state of paralysis. Anacardium. Anacardium is highly syphilitic and the sense of right and wrong is abolished. As you know now, one side, the two wills coming up and then one advised by devil and the other advised by angel and all that is anacardium, where there is a lot of antagonism and the sense of right and wrong is abolished. In epis, psoric phase will be jealousy, industrious and urinary tract infections. And of course, urticaria as well, where there will be a lot of redness and itchiness. In the psychotic phase, the mental symptoms will be dictatorial, discontented. And in the physical plane, there can be anasarca, which means there will be collection of fluid and it will be like angioneurotic edemas. For such things, EPIs can be given and bag-like swelling under the eyes and all that. Then in destructive phase, in the syphilis, there can be indifference, apathy, and it can be given for cancers. And it can be given for big ovarian tumors, which where the that CA125 will be very high. That means the malignancy, the tendency for malignancy is more, cancer. Then yes, urticaria will be in the psoric phase, angioneurotic edema in the psychotic phase, and in the syphilic phase, what it can be? Anaphylactic reaction, where death can ensue because of the swelling in the throat or in the epiglottis area. There will be complete obstruction, there will be swelling and it will be blocked, the airways will be blocked and the patient can fall dead. I have seen such cases, guys. After taking prawns at the hotel itself, on the hotel table itself, the lady fell dead because the prawns has caused the hypersensitivity reaction and the swelling inside happened and she was not able to breathe and she fell down there dead. Beraita. Beraita again well known for its indiscretion. Belladonna, suddenness and congestion, restlessness, the pain comes suddenly, goes suddenly with lot of congestion and redness. Of course, very less of belladonna symptoms in the psychotic phase and immediately it goes into the syphilitic, that is violence, mania, biting and striking. Coming to calcarea, anxiety, apprehension and confusion in the psoric phase, slowness, timidity, weak memory, and tumors in the psychotic phase. Calcarea is mostly like psychotic. And the psychosis will protect calcarea. It will be, eventually it will be having some syphilitic symptoms, that's all. So the calcarea fellows are all very lucky. Cannabis is again timid, slowness, cowards, and tumors. Like cannabis sativa is very great for tumors. Fancy is exalted, confounding, cannabis, the thought process, syphilitic thought process. Causticum, again psychosis, full of ideas and intellectual. When it comes to the syphilitic phase, it can be revolting, it can be anarchist, and there can be paralysis. In carcinosin, there can be leukoderma. So here, sir would have meant any color changes like tinea or something. No, any paleness in the skin can be considered as leukoderma. That is why it is put in the psychotic chart. And in the syphilitic, it can be the growth of cancer, and mentally it can be a perfectionist. Perfectionist to the core, like OCD, which is disturbing others as well. That is why it is put in the syphilitic chart, in the syphilitic column. Coming to China, in the psoric phase, it has got extreme sensitivity to touch. In the syphilitic, it is violent, anger, excessive. In ferrum, it is sensitive physically. You know about the crackling of the papers and ferrum will get that sensitivity. And in the syphilis, it is a fighter. Ferrum picks up the courage and it becomes a fighter there. It becomes strong and it is subject to hemorrhages. where there will be breakage of the blood vessels or the capillaries. Then gelsemium, lot of anticipation, nervousness, and apprehension in the psoric phase, and incoordination of muscles in the syphilitic phase. Heparsulf, it is most famous for its hypersensitivity. And in the syphilitic phase, it has got that violence and anger and impulsive to kill and to put everything on fire. Yes. Hyoscyamus, it is known for its naivety. Then it can be jesting and inciting and almost inciting and putting others into foolishness. Hyoscyamus in the psychotic phase. Shamelessness and mania in the syphilitic phase. Iodum, again sensitive and restless in the psoric. Indurated glands, yeah, hard glands. Indurated glands, you can think of iodum in the psychotic phase, and destruction or atrophy and all in the atrophy of the pancreas and all happens in the destructive phase. Ignatia, sensitive, emotional, and diligent. Intellectual and that silent grief will be taking over in the psychotic phase, and it can be plainly hysterical in the syphilitic phase. Coming to Calica, well known for its anxieties and the workaholicness, and in the syphilitic phase, there can be aversion to family. Lachesis, of course, the sensitivity, aversion to tight clothings, and in the Lachesis is full of life. It is full of ideas and jesting and witty. In the syphilis discoloration. Lycopodium, again well known for its anticipatory anxiety, and it is mostly psychotic, where it has got that love of power and dictatorial, but it is timid at the same time. Lot of flatulence and constipation. Anxiety, well known for anticipatory anxiety. And in the psychotic phase, it is the king of psychotic remedies. It gets forgetfulness and lot of fears, any kind of fears in Madorinum. Mercury, predominantly syphilitic remedy. It is revolting, defiant, and gangrene can be there. Natremure, inflammations and anxieties in the psoric phase. Warts and introverted and reserved in the psychotic phase. Cracks at the corners of mouth and suicidal tendency due to sadness in the syphilitic phase. Nitric acid, again, predominantly a syphilitic remedy, malicious and unforgiving and foul smelling. Naxomica, very sensitive to noise, and not only to noise, to all the external impressions, and it is very zealous in the syphilitic phase. Opium is quick, fast, and cheerful, and there is acuteness of senses in the psoric phase. It is witty and has gigantic plans and torpor there in the psychotic, contented ecstasy, and lot of fancies in the syphilitic. Phosphorus is caring, loving, and sensitive. Platina, egotism, haughty, and cast away. Pulsatilla, very mild, yielding, weeping, and dominating and selfish and having tumors in the psychotic. Sulfur can be the ragged philosopher or theorizing in the psoric, boaster in the psychotic, and cranky in the syphilitic. Strange crank, not crank. Silesia, coward and timid. Thuja, cautious. Stramonium, yeah, I shall give you an example of Thuja cautiousness. How the Thuja cautiousness can be seen in our day-to-day clinic. When the patient is having a osteoarthritis, having a joint pain, where there is wear and tear, it is psychosyphilitic, and the patient will be having a fear that he or she will fall. So what he will be doing? He will be either, he will be, if he has got the trust, he will be taking hold of the bystanders, or mostly they will be clinging on to the walker. They will be bringing the walker into the clinic also. So such patients, you can first of all rule out Thuja there. Cautious, because what if I might fall? What if my assistant did not hold me properly? I don't want to fall. That fear of falling will be immense in Thuja, and Thuja is very, very cautious and anxious, and it will be rather, let me take the wheelchair or let me take the walker. Let me take the walker will be the attitude of Thuja. Stramonium, it is highly sensitive and fearful in the sensitive in the psoric, fearful in the psychotic, and panicky in the syphilitic. Sepia can be sarcastic because it is timid. That's why it can be sarcastic in the psychotic, and total indifference and apathy in the syphilitic. Tarantula, highly syphilitic and destructive. In Tarantula hispania, there can be destruction and deliriums, whereas in cubensis, there can be destruction of the tissues, which will be very, very painful. And in tuberculosis, there can be fear of dogs, and in syphilitic violent, whereas or the idea that every medicine has got its own soric phase, its own psychotic phase, and its own syphilitic phase, and the symptoms will change accordingly, or the intensity of the symptoms will change accordingly. The need of the patient will change accordingly. So, according to the miasm of the disease, what is presented in front of you, you will have to select the medicine, of course, according to the sphere of action. So far, or can we go to the next? All good. English has got its topic. Hopefully, this is confirmed for all of you. This is good for all of you. Yes? Just give me some indications so that let us go to the next chapter. All good? All are sleeping? Thank you, Gopinath. Yes. Thank you, Swati. Okay. Yes, Anusha, Mangala Rupini. Yes, Soumya. Okay. So now, yes, Nancy. Now going to chapter 25, that is miasm in dreams. How many of you would like to know this? And how can you advocate this in your day-to-day practice? This will be really good. Now, significance of miasm in dreams. As mentioned earlier, so I'll be reading this little fast, so be closely through the lines, okay? As mentioned earlier, the miasm, which is the defensive trait of the body, has to reflect on mind, body, disease tendencies, likes and dislikes. All these are conscious aspects of the human being. If it goes through and through the same defense tendency or miasm, it has to reflect in the dreams also, which are a part of our subconscious selves. So miasms can be explained through dreams as well. More often than not, the dreams or the subconscious mind is a forerunner of things to come. On the other hand, the dreams can be the result of the state of mind too. If you're anxious, you can be getting a lot of confusing and anxious dreams in your mind. If you're restless, or if you have not achieved anything, or if you're self-punishing you, or if you're self-analyzing, or if something has not gone according to your wish, then you will be disturbed, and then you can be having some sorts of dreams. And Vijay sir says that this can be the burst of latent aura kind of thing, no? Like from the subconscious mind, some thought process are thrown out into the conscious state, which some things you will be remembering the next day. Many things you may not be remembering. So if the intensity is more, then you will be remembering that, and that can give an insight to your diseases, or to your upcoming disease, or what diseases you are going to get, or maybe your miasm also. See the next paragraph. An individual dreaming of snakes biting him. Yeah, dreams of snake biting him or terrorizing him is considered as a bad sign. This invariably indicates that the individual is going to develop or has already developed an autoimmune or an incurable disease. So this can be considered as a foreboding. So most often, very rarely, if one snake has come, then that is fine. But then mostly, all these people who are having the autoimmune diseases, or who are about to get that, pehle the changes will happen inside the mind or in the thought process even before the disease has started showing symptoms physically. So mentally, and maybe even in the subconscious mind, the changes for the autoimmunity or the destructive diseases like cancer has already developed. So from the dreams, that the angle is shifting or the gear is shifting. What is that dream? One of the dreams is the dreams of snakes, which is not considered as a good sign. A dangerous dream. So this is the importance of homeopathy, where the doctors can be prophetic and you can give the right medicine. and then that the dreams also will be gone, and then the cells will change back to normalcy, or it will not have been produced on the body itself. The patient may not be knowing, or the world will not be knowing, but then you as a physician knows that the patient is improving or not. Yes. When you're giving an XYZ simulum and the patient is getting bad dreams very often, you know that your medicine is wrong. Yeah. So this miasm in dreams can be taken as a tool to judge the capability of your medicine as well. The next paragraph: a dangerous dream of fire, accidents, mutilation can indicate a syphilitic disease existing in the body or else about to invade the body. A dream of accumulation or construction can indicate that some psychotic disease is in the offing. Soric dreams are dreams of work, anxiety, irritation, etc. Swati, only snake bite is syphilis, or just seeing snake? Yeah, seeing snake is also syphilitic. Seeing snake means, I shall give you an example here. In one of the medical camps of Vijayakar sir there at Matunga, a child was brought who was a cerebral palsy child, and he was confined to the wheelchair. MRCP child he was. And his body was like this and like this, no, like Ashtavakran. All sorts of, the spine was having kyphosis and scoliosis and all sorts of bends and curvature in the body, and all the joints are gone and the reflexes are hyper, and no understanding, and very sad and pathetic to see. And the mother is a very nice lady, and Vijay sir was asking her, yeah, during the pregnancy, what had happened, especially in the first trimester, what had happened, or in the first month, what had happened. The lady said, yes, doctor, even in the first few, even in the beginning, even when she knew that she was pregnant, not like the initial state itself, I started getting dreams of snakes, millions. See the importance, guys. When you see that dreams of snake means, oh, one dream of snake, it's not like that. It has got its own implications. Millions of snakes, yeah, again and again, or almost daily. Almost daily means every night the patient will having the same kind of dreams, or any other dreams where snake will be there. For sure, throughout the pregnancy, she was having this bad forebodings. So with itself, with this dream itself, the lady will be terrified. And there was one dream which she was in one night, she said that, and then the balloon grew. Am I audible? My internet connection is quite, is little unstable. Yeah. So the balloon grew and the snake grew. Okay, the balloon grew and ultimately the balloon broke. It was pouring out snakes. Look, intensity. Now, am I audible? Breaking of voice, huh? Yes, Anusha, am I audible? Now, this is better. My voice is better? Okay, okay. So here the lady was having the dream of the balloon growing up, and the snake inside that was also growing up, and eventually the balloon broke, and then it was pouring down snakes. So now you can understand the syphilitic intensity of the dreams of snakes. It is like once you saw a dream. It's not like that. Almost like a message from the universe. Like you will be getting this dream again and again in multitudes and millions, and sometimes you will be surrounded by snakes all over, and sometimes you will be lying down on the snake, or sometimes the snake will be biting you, etc. No? So now you got the intensity of the dreams, no? The syphilitic intensity. Whereas in the psychotic intensity, if it is in the psychotic state, the patient may not be seeing snakes. The patient will be seeing something. Just a minute. Swati is asking, can fear of snake gives it be it will be psychosis. Rightly said, Swati. According to part of your anxiety, you can even see buildings falling on you, or anything you can see according to the anxiety, the even the psychosis can be brought in there. What is the connection between dreams of snakes and autoimmune diseases? Actually, Dr. Gopinath, this was advocated by Dr. Vijaykar sir. This postulate was given by Dr. Vijaykar sir. So we follow him, and it is a kind of a coincidence which was again and again. In diseases, in all the autoimmune diseases, and in all the genetically mutated cases, you ask about the dreams. What is this autoimmune disease all about? It is about self-killing, which means it is destruction. And the genetically mutated cases, again, there is no scope until the gene is repaired. Yeah, the child will be having all sorts of disabilities, the mentally retarded, cerebral palsy, etc. So actually, there is a scope of reversal in homeopathy and in homeopathy only. This is the reason why we are doing all these camps for such disabled children or such special children. So, coming to the syphilitic or the highly syphilitic, even destructive diseases like cancers, okay? In cancers also, there will be genetic mutation. So, in all such disastrous cases,
How did sir correlate this dream to that case, madam?
I'm coming to that, Lata. I'm coming to that.
Okay,
In
sorry.
all these destructive diseases, you just probe about the dreams of the patient as well. You are want to take, you all need to take what? You all need to take the syphilitic symptoms there. What was the thought process in the mind which has attracted the syphilitic disease physically? Even before the symptoms are shown in the body, the mind changes. This is what we have learned all through. Yeah. The syphilitic thought process will be there, and then the syphilitic disease comes. So here, even along with the mental symptoms, there can be dreams also as some indications. Vijayakar sir has always given examples that he has got his own theories, okay? And we have found that to be right according to our experience as about like 50 plus. We have been with Vijayakar sir for more than 25 years, and we have started seeing such things in our cases. Initially, we did not believe that the syphilitic miasm can be reversed into the psychotic miasm and then into the psoric miasm. We thought that the gangrene or the destructive diseases has no reversal. We all believed that. But then after coming to Vijayakar sir's acquaintance, we started seeing such things in our clinic. When you practice it fruitfully or when you practice it truthfully, you will be able to see such diseases, see such changes happening, such good changes happening. Similarly, I advise now to you all to understand the syphilitic background, including the dreams in such disastrous cases. In Matunga or in any other camps where Vijayakar sir was leading the medical camp, sir used to make the ladies narrate, the mothers narrate, where you take the history of mother. The mother will be saying all these symptoms of the dreams. If not the snake symptoms, it need not be the snake symptoms always. But then he had given us many examples of many violent cases of snake dreams for such kinds of autoimmune and the genetically mutated or any disastrous destructive cases. So this is what I know about about the dreams and diseases. So this, I don't know why he is or how he has reached to that. I have no idea about that. Now somebody is asking some other. Sai Narendra is saying snakes are the indication of something wrong going to happen. It is a warning sign. We need to give importance. Even in psoric and psycho, of course, yes. It is a warning sign. We need to give that. We need to give importance even in the psoric or psychotic cases as well. But then we know that the if it is again and again, you know that the patient is already in the syphilitic. Yes. Are you with me? Snakes are our protectors. They are a sign of warning, telling that danger is approaching to life. All these things are your understandings, and I appreciate that.
Yes, ma'am. Ma'am, one more case in the SCPH Infinity, Amrish sir told snakes also represent our what Kundalini, that Kundalini, and everybody has this tendency of snakes in the astrology also. If the snakes comes in the dreams again and again, even if it is a psoric case, whether it is a psychotic case, if the person says I am getting repeated dreams of snake, it has to, we should note that we have to treat that patient immediately, because syphilis is going to come.
Yes.
Specifically, it has came in the subconscious. It is going to reflect in the gross body. Before that, we
Yes.
have to interrupt with the medicine. That's what sir told.
Yes. Again and again, snake dreams means you know that already the patient has come in the syphilitic thought process, or the syphilitic phase the patient is already there in. Maybe his sora can protect him, or his psychosis can protect him. If he is having a psychosis predominance, then he is well protected. Shubhangi is saying Nag Sarp Dosh and all in Kundalini. Now, this is a very basic class where I don't want to talk about all those things, because there are very, very junior doctors as well in this group. So along with Vijaykar sir, it was a time, it was the golden period of homeopathy, where we senior doctors had the opportunity, the golden opportunity to be with Vijaykar sir, to sit with him physically and hear his talks and experiences. It is where there is no comparison and where there is no judgment, and he gives everything in proof in the form of live patients, live on the stage, with thousands of us sitting and watching, and the way the way how he explained all those things and how he correlated all these things, and with his immense knowledge in astrology and the, I don't know, the universe, and with his wisdom and with his Vedant, how he narrated and how he brought all these things into the patient live on the stage. His antenna was so big. There is no words for that. So we are all elements of that, having mild talk. We are all small torch bearers. And what we know, now we are sharing it to you. We took it all unprejudiced from him. And whatever he says on the stage will be tested hundreds and thousands of times in his own clinic, where every day he was seeing almost 300 to 500 patients in his private clinic, and in everywhere he was having in around 140 or somewhere so much of places where he was conducting medical camps. And at one medical camp he will be having more than 2000 patients. This is not exaggeration, I have been there. More than 2000 patients will be there in one medical camp. Similarly, he was having, I don't know how many medical camps he had with all the assistant doctors and the panel doctors, because Vijaykar sir alone will not be able to see 2000 patients per day. But then all his panel doctors are equipped with such kind of knowledge, and they are all tackling cases. It is not the domain of Vijaykar sir alone. He has shared everything to the world. Now it is our turn to understand and to accept all these knowledges and to verify all these knowledges. No need to accept it blindly. So with this knowledge, it is all about the immaterial and the metaphysics and the epigenetics that Vijaykar sir has taught us. He has taught us that homeopathy, and even Hanuman has said that the material and the immaterial. So this itself will go for one day full lecture. So about the immaterial thing, how many of you are ready to believe the immaterial thing? In the scientific world, nobody can believe anything until you see that or until you touch it and feel it. Even I was like that. We are all skeptical. But then once we started seeing such things with our own vision, then we started believing that. So here, I am not asking you to just believe this blindly. With this knowledge, you try and elicit in your own case. You find out in how many autoimmune cases or in such destructive diseases or genetically mutated cases did you see such kind of syphilitic symptoms. Not only the snakes everywhere. Snakes are one of the syphilitic rubrics, so one of the syphilitic symptoms or the dreams. And now you know the importance of the snake rubric or the snake dream. So it is not just one single snake somewhere. We all would have had that one single snake here or there, and that would be like once in a blue moon, and we have forgotten that, and we have no fears about that. But then here, when the patient is having such kind of syphilitic dreams, it affects the patient, and the patient is disturbed by that, and the patient will want to say this to someone. See, or the patient will want to know, why is this happening to me? And the patient is feeling from head to toe, will be having that kind of a panic or a fear. So this is not the normal snake dream. Hope you understand the intensity of that. Yes? Am I good enough to go to the next paragraph? Yes, yeah. So this is how the importance of snake is all about. Yeah, thank you, Swati. So it is not only about the syphilitic thing. In the psychotic phase, what sorts of dreams the patients will be seeing? There can be accumulation, like Dhanalakshmi, the goddess Lakshmi pouring all those the gold booze or the money for can be like as if you're buying a lottery ticket, or it can be any kind of construction, buying land or building flats. All those things can be seen in the psychotic diseases. And in soric dreams, we all have such thing like dreams of work, yeah, and dreams of anxiety and dreams of irritation. So this often helps us an assessment of the follow-up and which tells us whether it is following the hearings. You can elicit by the dreams, you can elicit and see the miasm shifting from the syphilitic dream to the psychotic dream or directly to the soric dream. Examples of soric dream: you have forgotten the pen to write for the exam, or you have forgotten the hall ticket, or you did not catch the bus, you missed the bus, or your friend did not talk to you. All these things are examples of soric dreams. So now here Vijaykar sir is giving us an illustrative case. In a case of a homeopathic doctor who had 99% block of the left carotid and 80% block in the cardiac blood supply in the left anterior descending artery, this type of through dreams proved very useful. This person's man was weeping continuously and hugging everyone as if this was the beginning of his end. He had had an attack of ischemia 1 year prior to this. Doctors had given him, sorry again. Yeah. So this was the case of a heart block, coronary artery disease, and the patient is having a right hand paralysis. He was a very strong and dictatorial man, and now he's weeping continuously and hugging everyone as if this was the beginning of his end. He had had an attack of ischemia 1 year prior to this. Doctors had given him very less chance of survival, and even operation to remove 2 blocks at a time was a great risk. Are you with me? Hope my voice is good. The next paragraph. To assess the block in a few days was very difficult. So here Vijaykar sir has given him a remedy. And how does Vijaykar sir know that whether the medicine has worked or not? He cannot go for angiography again and again to assess the block. But the block was assessed, or the improvement in the case was assessed just by looking into the dreams. How does one realize that the remedy is right and we are on the right track? The block is completely psychotic and it is hidden. In this case, the patient had a dream of jugglery on the first day of starting the treatment. Jugglery, you know, na, the tossing of objects. This was perhaps his biochemistry, which was disturbed. That is, it is a soric dream. Change in the homeostasis. History was to guide him, and fourth day he started moving his right hand that was paralyzed. Yeah, he started getting movement in his right hand, and the first thing he did was to sign on his checkbook to withdraw all his money from the account, which had become frozen without his signature. On the fifth day, he reported of having a dream. Yeah. What was the dream? In which he saw that he was visiting a site where a house was being constructed. And this house belongs to a prominent mafia boss who was accompanying him there. He was surprised because he was never ever associated with this man. And why should he come in his dream? Above all, he had nothing to do with any construction or designing. For me, this dream had some different meaning. He was in total despair because of his condition of paralysis of right hand when the single dose of the similimum was given. So this was a syphilitic stage of the disease, which was characterized by paralysis and despair and overwhelmed with emotions. Now he was seeing dreams which showed construction, a mafia boss, and designing and creativity, all of which characterized the psychotic miasm. This indicated that the disease of arteriosclerosis, comprising of accumulation and construction, psychosis, which had earlier progressed to syphilitic stage of destruction, was now on the point of returning back to the psychosis state. For me, this was an indication sufficient enough to assure him that the disease was under control and that my similimum has started working. So just with this dream of construction and being with the mafia boss and all that, the dream is in the psychotic miasm. So Vijay sir understood that the syphilitic stage is coming down and it is going to the psychotic phase. This indicated to me the sixth corollary of return of disease from more destructive miasm to less destructive miasm being seen and cure was in progress. On this very indication, I could dissuade him from going in for any operation. So with this miasm, Vijay sir confidently said that you don't have to go for any surgery because already the medicine has started acting upon you and already you are on the phase of improvement. After the eighth day, he got a dream in which he saw himself and his son driving a huge truck through a very narrow lane. Narrow lane means what? Again, the block and all that, no, in the artery, and then there is a block. So he is just narrating it here. Just go through the lines. He got down from the truck and the son went to park the truck in a parking area and did not return. So this gave him a lot of anxiety in the dream. So anxiety means which miasm? You know that anxiety means it is the soric miasm. So here the huge truck was like the psychotic block in a narrow artery. The truck indicates the psychotic miasm. The narrow artery, it gets stuck in the narrow artery, which means just like the block or the clot or the thrombus getting stuck in the narrow artery, indicating psychosis predominance. The later part of the dream showed anxiety, which was soric. This meant that he was now returning to the psychosoric sphere. From the psychosis, he is coming back to the soric sphere. A few weeks later, he got a dream where he saw his clinic burgled. Yeah. He saw the lock in a broken state on the outside of the closed door, and there was tremendous apprehension and anxiety about what he must have lost. This was a clear dream of soric anxiety. After this, his hypertension, blood sugar, lipid levels, and serum uric acid levels, all of which were never normal before, even with the help of allopathic medicines, became normal without any maintaining drugs and still remain normal today after 5 years. What do you understand from this? Once the medicine has been given, yes, once the medicine has been given, through the dreams, Vijay sir, by judging the dreams, Vijay sir was able to understand the shift in the miasm. And that's why the shift in the body has to happen. It has to follow anyway. That is the mathematics. So maybe that jugglery thing, no, I think I made a mistake there by saying that thing. Maybe that jugglery and that precision and all the we will write. Jugglery or much precision in hat can be of the chemical derangements after that because it was the image of a syphilitic thing as well, no?
Can you please repeat, ma'am? Your voice was not audible.
Yes. So dream the patient going. The construction site means it is the psychotic. Mafia boss means it is the syphilitic. So it is coming from the syphilis to the psychotic. Vijayakar sir analyzed it this way. And the next day or within 2 days time, he got another dream of going by a truck and getting struck in a narrow lane. So which means the syphilitic thing is completely, and the psychotic thing is there. There was little bit of anxiety element also there. That is, his son went to park and the son did not return, giving rise to anxiety. So from the syphilis it came to psychosis, and from the psychosis it is coming to the soric. How we generally used to say psychotic or psychotic. It was syphilitic, and then eventually only soric, purely soric. That is, the burglar has come and then he has taken away something and all that. So this is how the Vijayakar sir has explained the shift of the miasm in the dreams. And by judging the dreams, he has judged the shift of the miasm from the more destructive miasm to the lesser miasm. And he has understood the action of the medicine. And with this confidence, he has prevented the patient from going for the surgery. And eventually the blood report showed that all the values are totally normal. The lipid profile, the everything, the uric levels, the blood sugar levels, the through the dreams, how can you, and it helps for out. Am I not audible? All good? This much is okay? This much is guys, am I audible now? Voice breaking repeatedly. Okay. So what we will do is we will stop the class today. It is already some 5 minutes left. I think we will stop it here today. We shall continue in our next class. Anyway, it is just 5 minutes left. So you all have a nice time. Love you all. Bye, dears. Learn well, read well, employ it in your day-to-day practice. Share with us the success and the failures. Bye, dears. Tata.
Thank you, ma'am.
Thank you, ma'am. Thank you,
Bye.
ma'am.
Yes.